Yeah, we had a little discussion on it. All right, now, we talked about her other leg, and we found most of her problems down a little lower.
Below the knee.
Now, on this leg here, very interestingly, it started at the very top.
Right.
Okay, so before I get into all this, when did she start having trouble with her legs? It's more recent, or has it been?
It's been a while she's been dealing with it.
Has there been kind of a change though, where all of a sudden it got worse enough, or? This is her first time with all this, and you know
she started with a foot doctor. They did the cortisone shot because she had plantar fasciitis.
I see. So she had other issues.
Right, and then he exhausted that effort, and then sent her to a physical therapist who did the dry needling. And he realized that he thought she had a circulation problem.
I see.
And then it ended up with you.
I hear you. I'm not being critical.
No, not at all.
Our world is like this,
right.
You know, and these things happen because it's kind of hard to know. Okay.
Yeah.
So with that said, whether she had plantar fasciitis or not, she might have, because you know you can get a lot of stuff. What I found up here was the upper artery was totally blocked. Okay. Now, it appears to me there's different kind of blockages in my world, okay? Mm-hmm. Sometimes they're real hard and they don't do much except they narrow and they close off. Mm-hmm. Sometimes they're a little bit softer, and what can happen is little pieces of it can move, okay? That's a common thing here. The blockages in this artery, called the carotid artery, they have little flakes of it that go up here and cause little mini strokes, okay? That's a very common thing here. We don't see it as much in the legs. That's just the way it is, okay? Now, some of these blockages, what happens is the way I see it, is these blockages are like pouring cement. You're pouring cement on a curb. You've got a good, strong curb there on the bottom on it. As you walk in time and rain, it crumbles. Okay, so some of these blockages are like that.
Gotcha.
Okay, this one is. Okay, when they get crumbly blockages, what happens is little pieces of them kind of go. I suspect that over some time she has been doing that, because I see down here where she don't have much flow. Because it's a different kind than just the blockage like that. I think she had some stuff here kind of going down. Can't change that. That's just the way it is. But when that occurs, it's very difficult to diagnose. It kind of comes and goes, and it's not a whole total blockage, but it's little blockages that cause some of these kind of symptoms, okay? Mm-hmm. Now, though, that blockage on the top, let's just say it was a 90% blockage 6 months ago, with little pieces of it causing her trouble, okay? So when that 90% completely blocks, then she don't have no flow, and she already got that damage down there. So I'm not being negative, I'm saying that's what I see.
Gotcha.
Okay, so that's when we went in there today. Instead of it all being down here, it was both places. Long and short of this, we utilized a laser balloon, and she required 3 stents. That corrects all of that from above.
On the left side.
That's on the left. Now, we already did the work over there.
Right.
So that's about all we can do, and hopefully that's going to do the good job. Now, the disadvantage, though, is that this kind of things, when happening down in them little arteries, render those arteries shrunken up over time. So she does not have good blood flow down in here, but it's a little different than the other side, okay, because it was from the stuff up top going down there.
Gotcha.
Now, I've been negative, just saying that's what we've got.
Right.
Now, with that said, we're done with our procedures. Her blood flow on both of these legs should be as good as they can be for her. Now, I'm going to add an additional little medication to her for circulation.
Good.
Okay, so we're doing the best we can with that, because she just has that tendency, okay?
Gotcha.
So long and short of it, we're done, both legs now. A little bit different pattern on each side, but we're maximum blood flow for her. Now, she ain't going to run the Boston Marathon, but she's going to be better.
Right.
Okay?
Her pain that she's still experiencing in that right foot from the plantar, what should she go do now to try to get the inflammation?
All right. So who's her podiatrist?
Tony Blanchard.
So Dr. Blanchard. Okay, I know him well. When did he see her last?
Oh, it's been probably 3-4 months now.
Okay, was he just waiting to see her back if it got better, or was waiting a little bit of time?
He did the referral to the physical therapist, and she has not been back.
Okay. It is, okay, so You're talking about the plantar fasciitis on the right or the left?
She has no problems with her left.
Okay, so that down there.
Just on that right
Okay,
foot.
is it still bothering her now?
Oh, extremely. She's
Still?
extreme pain. Yes. Yes. Even after your surgery, it didn't
Well,
really resolve
again,
it.
we've corrected some of
Right.
this, okay?
Right. Right. Um,
She's diabetic also?
no.
Okay. What is she doing for the pain? Anything, or in other words, does she have any topical, any medicine, anything? I mean, I'm trying to help out.
No, she just uses a special insert in her shoes that she wears.
Okay.
And,
All right. Well, okay. Here's what I'd recommend. I'm trying to help. Okay. It's hard to see people.
Right.
You know, who knows what's going to happen now? Okay. So what I would recommend is I'm going to look over her chart. She's still having that. I'm going to put her on some medicine to help.
Good.
Okay, so I'm going to treat her for inflammation down in there
Good.
anyway, okay? There's going to be a medicine, and then there's going to be a topical cream.
Good.
Okay, this topical cream has some medication that will help with neuropathy, which is burning, and even fasciitis, and some microcirculation stuff. Now remember,
Good.
she's got some circulation problems down there that are improved, but she's still having residual symptoms. These will be directed towards inflammation and, let's say, non-vascular stuff, okay?
Gotcha.
Number one. Number two, we're going to add other medicines for her circulation. I think the best thing for her is for us to do this for 2 weeks. I'd like to see her back over in my office.
Okay.
Okay, I would offer to see her, see how she's
She'd
doing.
like to meet you.
And well, she's met me, but she won't remember.
Okay.
Because of sedation. Okay?
Right.
So in that way, I'll be able to judge a little bit better whether this would go back to a podiatrist or whatever.
Good.
Okay, you see what I'm
Okay.
saying? So I'll try to help you all.
That was her question
on
for
that.
me to ask you was what next if this didn't relieve her pain?
Well, what's
Right.
next now is we're done with the circulation as best we can.
Correct.
We're now going to add the additional stuff.
Good.
Give that 2 weeks and then make our judgments of what's next.
Gotcha.
Fair enough?
Fair enough.
Thank you.
Thank you,
All right.
bud.
All right.
Appreciate it, Doc.
All right.
Thank you very much.